Hello everyone, yeah, welcome back to our discussion class. Okay, so as you all know, my name is Jane Nnenna Ezikeanyi. I'm a public health master student of the National Open University of Nigeria. So we're just treating one of our course in master program, which is public health pharmacology. And today we are going to be discussing on the topic pharmacovigilance in public health programs. I think it's a very interesting topic. All right, so let's get started immediately on what is pharmacovigilance and everything in between. So pharmacovigilance is defined as a science and activities relating to the detection, assessment, understanding, and prevention of adverse effects or any other possible drug-related problems. Okay, so note the keywords: detection, pharmacovigilance, just like from the word vigilance. Detection, assessment, understanding, and prevention of adverse effects or any other possible drug-related programs. So recently, its concerns have been widened to include herbals, drugs, and complementary medicine, blood products, biologicals, medical devices, and vaccines. So added to pharmacovigilance, under pharmacovigilance industry or under pharmacovigilance departments, apart from drugs, the normal chemical made drugs, even herbals, traditional, and complementary medicines have been added to it. Okay. So pharmacovigilance, which is denoted as PV, is an arm of patient care. So it aims at getting the best outcome of treatment with medicines. No one wants to harm patients, but unfortunately, because of many different factors, any medicine will do something to this. Okay, so any medicine is liable to cause harm or an adverse effect. So that's why pharmacovigilance is here at which aims at getting the best outcome of every treatment with medications. So ensuring pharmacovigilance in public health programs becomes a necessity. Why? Because many public health programs are involved in direct administration of medicines to large populations and communities for the prophylaxis, treatment, and or eradication of diseases. You know, when it comes to public health, just like the name public, so a lot of millions and billions of people are involved. Okay, so that's why this pharmacovigilance integration into public health programs is very, very important because we need to protect people's life. Therefore, um, public health programs and pharmacovigilance can drive mutual benefits from each other. Okay, number one is a pharmacovigilance and adverse drug reaction monitoring in public health programs can detect rare adverse events and risk factors in patients and can have a tremendous positive impact on the implementation and success of these programs. While also public health programs can provide an opportunity to introduce pharmacovigilance in many countries that lack a system for drug safety monitoring. So registers and databases have been created and used as a foundation for statistics that allow medical care providers to oversee potential risks and minimize them. So the success or failure of any pharmacovigilance activity depends on the reporting of suspected adverse reactions. Okay, so this is just a preamble. We're going to be looking in details this pharmacovigilance integration in public health in the subsequent slides. All right. So what are the origins of pharmacovigilance era of safety monitoring? Like we said that pharmacovigilance is detection, assessment, like just getting to know that drugs are being safe for people, that's for the public. So how do this pharmacovigilance comes about? Because something must have triggered this strict assessment of a lot of drugs, okay? So there are a lot of reports or a lot of reported cases of adverse drug reactions or adverse drug events that lead to this development of pharmacovigilance team. Okay, so the first reported case of adverse drug reaction occurred over 150 years ago in 1848, where a 15-year-old girl from the Williamson, Northeast England, had a routine general anesthetic while undergoing a surgical procedure from an ingrown toenail. So this anesthetic agent, which is chloroform, had only been introduced into the clinical practice a year earlier. So since it produces less nausea and vomiting than ether, ether is another anesthetic agent that's being used. So this girl died during the anesthesia, from what was probably an episode of ventricular fibrillation, which is a life-threatening heart rhythm disorder that is inadequate heartbeat. Okay, so it found out that this chloroform lead to this. Okay, so anesthesia-related death was reported by the authority, and the findings were subsequently published in Medical Journal in 1893. All right, so this leads to eye-opening and awareness on the use of this particular anesthetic agent, chloroform. So another early incident of harmful effects of drug was recorded in 1937, where a formulation defect in elixir of sulfonamide resulted in poisoning. So this led to over 100 deaths and highlighted the need for pre-market safety testing of drugs, ultimately leading to the passage of the 1938 Federal Food, Drug and Cosmetic Act, FD&C Act, which shifted the focus of the Food, Drug and Inspection from primarily a policing agency to a regulatory agency. Do you see why I say there must be a trigger before the formulation of this pharmacovigilance thing? So these are triggers, these are reported cases, a lot of them. Okay, so another key event, another key case of this adverse reaction is the event of thalidomide disaster, which occurred in the 1956 to 1962 in the 1960s. Okay, so as I've explained this thalidomide disaster in our previous discussion, that was when we are discussing adverse drug reactions, right? If you have been following through this our discussion, so about 10,000 children were born with severe malformations, including the phocomelia, so which lead to a strict monitoring system for drug safety. Okay, so this thalidomide, let me just recap on what it's all about. Is a drug that was used by pregnant women then to treat nausea and all this morning sickness that happened during early pregnancy. So it was later found out that most children born by these women that used this thalidomide had a severe birth defect. Okay, for Comely, I'm going to be showing you a picture of one of them. So this the a child that has a deep focomelia due to the thalidomide disaster. You see the short limbs that is the hand attached to the limbs of the child. So these are the birth defects that these children had during those thalidomide disaster and leads to this termination of use of this thalidomide by pregnant women. But this thalidomide is still being used for other diseases. But for pregnant women, no. Pregnant women don't use them anymore. Okay. So how drug safety is assured? We are talking of pharmacovigilance and the safety of drugs. All drugs undergo a significant amount of testing and evaluation before marketing to ensure the effectiveness as well as the safety. Marketed medicines undergo trials in animals, that is preclinical testing, and also in humans, which are clinical trials, to establish the efficacy, safety, and quality. So if you follow through when we are discussing about drug development process, drug discovery and development process, I think you should be conversant with all these process. There is the preclinical and clinical trials. So we have pre-marketing evaluation, which involve animal studies and clinical trials in humans. We also have post-marketing surveillance, which helps to detect all those safety-related problems that we're not able to detect in pre-marketing. They have been detected even when the drugs has entered the market. Okay, so after drugs have been released on the market, NAFDAC, that is for Nigeria, the manufacturers, importers, and healthcare professionals are responsible for post-marketing surveillance of these products. So, like it's majorly said in pharmacovigilance, everybody is involved in drug safety because it actually affects everybody. Everybody takes drugs one way or the other. So everybody should be actively involved. Okay. So we have different regulations, and for those that have not seen the content of on a drug discovery and drug development process, I'm going to be leaving the link to the video so you get to watch and catch up on how drugs are being developed, okay? How drugs are being discovered and the processes that lead to in drug development. So I'm going to be leaving the link in the comment section. All right. So we have different regulations around the world. that is involved in pharmacovigilance. We have the USA 1962 FDA, which require both safety and efficacy data. We also have the UK Committee of Safety of Drugs. We have a lot of them, even WHO, the European Union 1965 EC directives. So these are the different regulations around the world. Excuse me, let me take some water. I think I've talked a lot today. My throat is dry. Okay, so we have detection of adverse drug reaction, mode of reporting. So when these drugs are being marketed in the to the public, okay, there's tendency to develop adverse drug reaction, and that's what pharmacovigilance is all about. They help to assess, they help to detect all these reactions. So we have different modes of reporting. We are going to be using a case study in Nigeria. So in Nigeria, there are two modes of reporting suspected adverse drug reaction. We have the voluntary and then the mandatory modes. So when it comes to voluntary, is when a healthcare practitioner identifies suspected adverse drug reaction and then report it to the National Pharmacovigilance Group, NPC. So it's voluntary for health providers and traditional herbal medicine practitioners. Although it is voluntary, it is the professional duty. Yeah, it's very, very important for a healthcare professional, especially those that administer the drugs, to be able to report if there's any adverse reaction, drug reaction to their patients. Okay, so though there's a side effect to this, there's a side effect. There's one common um should I say maybe a gap? Yes, because I did my practicum in NAFDAC, that is in the course of our master's program. So what's one of the key things they actually let us know is that most of these healthcare professionals, they don't report adverse drug reaction because sometimes they have this fear of, okay, what if they actually laid me off at work or a lot of things. So a lot of people don't report this adverse drug reaction, especially the healthcare practitioners themselves. They don't report because they don't want maybe any problem, or they don't want maybe for themselves to be a trace in all this progression. But it's a very simple something. Nobody will use it against you when you report all this adverse progression, because it's actually going to help a lot of people. So we also have the mandatory mode of reporting. So it's mandatory for all market authorization holders, that is for those distributors of these particular drugs. These include the manufacturers and the local agents in Nigeria, including public health programs, to report adverse drug reaction related to their product. So it's mandatory for all the drug producers, the manufacturers, the agents, and every other person. So we have a strategic method for detection of adverse drug reactions. We have the passive and the active pharmacovigilance. Okay. So the methods for detection of ADR, for the spontaneous reporting of adverse drug events, which is also known as passive pharmacovigilance, it relies on spontaneous or voluntary reporting of adverse drug reactions by healthcare professionals, patients, or the pharmaceutical companies. Spontaneous reporting of adverse events identified during the use of any medical product is mandatory for the manufacturer, just like we've said. The reports received by the center as part of spontaneous reporting shall not be made available to support any legal or administrative or any other action that may be detrimental to reporting health professional or the patient. Okay, so the advantage of this passive mode of detection of ADR is that it's very simple, it's cost effective, and is widely used. And then the disadvantage is on the reporting of ADRs, incomplete information about patient populations, and difficulty in detecting rare or delayed adverse drug reactions. So what is spontaneous or the passive pharmacovigilance or mode of reporting ADR? It's talking about that when these drugs are being given to people, or when these marketers or manufacturers have distributed these drugs, so um they are giving them mandatory to actually report any adverse drug reaction if it occur. Okay, so if it did not occur, they will not report anything. But if it occurred, they should report. Okay, so he just like telling somebody, okay, just take this drug. If there's any adverse reaction, just report to me. So the person may not, or the person may even forget, or the reaction may even just go, and the person will not even report, or the person may end up not even reporting. So that's the disadvantage of this. It's under reporting of ADR because it's a kind of willing or voluntary reporting, though it's mandatory, but you don't hold the person if the person doesn't report. Do you understand? So you're just telling the person, okay, if you see, you should report. A lot of people will see and will not report. So that is spontaneous. So let's talk on active pharmacovigilance. So it involves actively searching for adverse drug reactions and other safety issues through various methods. So it could be in form of cohort event monitoring, prescription events, monitoring intensive medicines monitoring program. So this, I think this is the major key work of a pharmacovigilance department, especially those in NAFDAC, okay? So they are actively going around, maybe going to different clinics or hospitals to seek out for any, if there's any active drug um reaction events, okay? So this is just like you looking for or searching for the adverse drug just instead of waiting for them to report to you. So involve actively searching for adverse drug reactions. Okay. So the advantage is that it provides more complete reporting, allowing for detailed analysis of safety events and can also detect rare or delayed ADRs. So the disadvantage is that it requires more resources because this one it involves you like a lot of times it involves traveling, okay, and also effort that is for manpower. So it can be more expensive to implement, unlike the passive or the spontaneous reporting. So note that active pharmacovigilance involves proactive measures to detect adverse effects, while passive relies on spontaneous report, just like what I explained. Okay, so we also have what is to be reported when it comes to this adverse event. What is to be reported? Number one, if you're taking a medication and there is no improvement after treatment, you have to report medication error, have to be reported, overdose, have to be reported, misuse or abuse of medicines, counterfeit or substandard medicine. I think this should be the most reported adverse drug events. Okay. So, case reports of acute and chronic poisoning, assessment of drug-related mortality, abuse and misuse of medicines, which can lead to antibiotic resistance. So, adverse interactions of medicine with chemicals, other medicines are full. So, all these things are what we all need to be reporting. Okay. So when do I report? All the stages of pharmacovigilance development that Nigeria is in, we need to report all safety issues of concern. By the time we will develop our capacity in detecting, reporting, and assessing of adverse effects of medicine, then we'll be in a position to report only serious areas. So at this point, at this stage of implementation of advanced event reports, everybody should report anything or at any stage of adverse effects. Okay, so instead of waiting, because a lot of people doesn't have that awareness of knowing when is okay only serious adverse events or non-serious ones. So if you just report everyone, then they know how to sort it out. So how to report adverse drug reaction? Do you suspect any adverse drug reaction? If it's yes, is it a serious reaction? If it's yes, report. If it's a no, is it a new drug? Yes, report it. Guys, if it's not a serious drug reaction and it's a new drug, please report it. Because most of the old drugs, you already know how this adverse drug reaction will be. Maybe it will go. All right. So if it's a new drug and is it a new drug? Maybe you don't know if it's a new drug or it's an old drug. Are you unsure whether to report? You should report. So the basic thing is, like I explained, you should just report at any um point in time. You should report. So, and you also got to know that there's a report form. This is majorly found on the NAFDAC website. I think I'm going to find that report form, like the link to that report form, just in case, because a lot of people doesn't even know that there's this kind of thing. Okay, So everybody have access to that report form, and there's also a website for it. So all these things I need to find out about them. Okay, so because I know that when we did practicum, we show us about the website, show us about the reporting form, where you have to fill the details of the patient, of everything, how the person is feeling, how like how the drug or is reacting to the patient and everything. So, and even the person has the ability to, a person that is taking drug has the ability to report to. It's not only majorly done by physician, or you can go back to doctor and report, and then the doctor report back to the pharmacovigilance team. So we have what we call casualty assessment or signal generation. So casualty assessment is assessment of relationship between a drug treatment and the occurrence of an adverse event. So it's also used to evaluate and to check that the particular treatment is a cause of an observed adverse event or not. So a lot of time when there is adverse drug events or adverse drug reaction, I think you know difference between these two. I've explained it. We're talking of adverse drug reactions. There's a key difference between ADR and ADE. This you should know the key difference. So when we're talking about the two, we're not being um misusing them. Okay. So casualty assessment is trying to check if a particular drug is what is actually causing that adverse drug reaction, or maybe it's another effect or another factor that is causing it. So that's what causality assessment is talking about. So it's an essential part of adverse drug reaction reports, an important task conducted by the National Pharmacovigilance Program in every country. So the objective of causality assessment are to provide relationship between the drug and event. And also to help to observe the signal detection, that is a possible causal relationship between an adverse event and a drug. It also helps to provide a better evaluation of the benefits or harm profiles of a drug. It plays an essential part of evaluating adverse drug reaction reports in early warning system and for regulatory purpose. So how the causality assessment is performed. Number one, you have a chronological relationship between the administration of the drug and the occurrence of adverse drug reaction. So many researchers develop various methods of causality assessment by using different criteria. So these are the different criteria like screening for drug and non-drug related causes, also confirmation of the reaction by in vivo or in vitro testing. We also have previous information on similar effects. So these are just the criteria on how to know if that of any causality assessments. All right. So method of causality assessments, there are different methods. We have the expert judge or global introspection, which are two methods of expert opinion or global introspection. Okay, so there are two key methods here. We have the Swedish method by William Paul et al. We also have the WHO Uppsala Monitoring Center casualty assessment criteria. All right, so the next method of casualty assessment by use of algorithms or by use of probability or Bayesian approaches. Okay, but there's no universally accepted method for assessing casualty of ADR. So these are the key three methods for assessing casualty, especially when relating to adverse drug reactions. I want you to do one favor to read up on this or research more on each method to know what it's talking about. Like I think in Nigeria, we majorly use this World Health Organization method as well as assessments criteria. Like you said, there's no universally accepted method, but any method is good. Okay, so just read up on what each method is talking about and then its components. So at this junction, we are going to discuss the pharmacovigilance in public health in details. Okay, so we're majorly concentrated on pharmacovigilance here. So, but here we're going to be talking about different public health programs and then integration of pharmacovigilance in public health. I think I gave a preamble on it when we get started with this. Okay, so if you are by this time you've not subscribed to the channel, please do so. Okay, so you keep getting notification on when I upload videos like this, and it's also a way of supporting me. that is in the class discussion. All right. So please subscribe. Just hit it. It's free to do so. You're not paying any money to subscribe. Just hit the subscribe button below this video. You see a subscribe button, and also give it a thumbs up and maybe share it to any of your friends or colleagues that you know that you actually benefit from this discussion. Okay. So as you do so, thank you so much. Let's get started. So pharmacovigilance in public health programs, they are structured initiatives. So what are public health programs, PHP? They are structured initiatives that are focused on specific health issues. You're utilizing medications or vaccines for prevention, treatment, or eradication of diseases and infections. So they involve large-scale use of medications or vaccines, necessitate a robust pharmacovigilance system to ensure safety and efficacy. So what this public health program is all about is just caring for the public, like, giving of vaccines, especially to children, even to adults. They involve a large-scale use, like for a lot of people. All right, so it's very, very important. Um, So in incorporation of this pharmacovigilance that we've discussed both in public health programs. So what are the goals and objectives of this pharmacovigilance in public health programs? Number one, to ensure the rational and safe use of drugs, to contribute to the assessment and communication of the benefits, the harm, the effectiveness and risk of medicines, and also identification of risk factors and possible mechanisms underlying adverse drug reactions, and educating and informing patients. Okay, awareness creation. They are the key overall goals and objectives. Then we have specific objectives, which is number one, early detection of unknown adverse drug reactions. Okay, detection of increasing frequency of known adverse drug reactions. That is those ones that are known, but maybe they keep getting reports or cases on them. Estimation of benefits or risks of a particular drug, dissemination of information to improve patient and public care and safety, to promote education and clinical training, and also to promote effective communication to the public, rational and safe use of medicine. So these are the specific objectives of these pharmacovigilance and public health um, programs. So there are different types of public health programs. You have educational programs, you have lifestyle and behavioral changes, you have environmental modifications, you have nutritional interventions, you have drug administration programs like mass drug control, case control programs, and individual treatment programs. So these are the different. They're not limited to these. There are a lot of public health programs that's maybe currently going on or that have executed in the past. So why should pharmacovigilance be integrated into public health programs? Let's see the key reasons why pharmacovigilance should be integrated into public health programs. Number one, integration can take appropriate measure, communicate effectively in health crisis. All right. So when you integrate the two, they can help to take appropriate measures and communicate effectively. Since one is dealing with the general public and one is dealing pharmacovigilance is dealing with assessment and discovery of every drug, adverse drug reactions. So integration can also strengthen existing normal pharmacovigilance or provides leverage for setting up a pharmacovigilance where it does not exist. Exactly. Number three is improve public health outcomes by preventing adverse drug reactions and promoting rational drug use. Pharmacovigilance contribute to reduce the burden of preventable drug-related harm to the population. Okay, so we also have let's shift this. So we also have it provides a mechanism to continuously monitor the safety and efficacy of medications, detect adverse drug reactions, and ensure that medication use is optimized for the target population. Then the last but not the least is addressing public health challenges in combating counterfeit and poor quality medicines. So pharmacovigilance can be used to identify and address the issue of counterfeit or poor quality medicine, which pose a significant threat to public health. So you see the various key reasons why PV should be integrated into PHP. Okay, so what are the strengths of the public health programs? Number one is well-established program using a limited number of drugs or vaccines. So public health program also operates according to standard guidelines. They also well funded with international support. Example, the WHO supports a lot of public health programs across the whole world. They also have monitoring and evaluation procedures. So PHP have um, a key guideline and also monitoring M&E procedures. Quality of products can be assured because there are a lot of guidelines that take place. Also, good database and expertise in assessment of drug safety. Then what are the weaknesses? Is that there is no direct contact with a physician. Diagnosis may be well diagnosed or presumptive. Lack experience in drug safety monitoring or insufficient follow-up. Lack of coordination between public health programs. May cover special population that poorly funded, which they majorly consider them as a luxury. Okay, a lot of time they poor funding of a lot of public health programs. So whenever it comes, it may be considered as a luxury, which something that is maybe is a necessity or something that is very vital in life. All right. So these are the strengths and the weaknesses of public health programs. So let's discuss on the threats to pharmacovigilance public health programs. So we have lack of political or public support. Okay, we have lack of funding or funding shortfalls, then misunderstanding of each other's roles. So this could be a clash on this integration of pharmacovigilance or public health programs. Lack of political or public support, short um, shortfalls of funding, and the misunderstanding of each other's roles. Okay, so we have a self-assessment for you. We have a 24 years old pregnant woman with normal liver function test was commenced on lamivudine, zidovudine, and nefinavir at 16-week gestation. So event jaundice leading to liver failure. So I wanted to read through this. So this is from those casualty assessments we discussed. Okay, so I just gave an answer hint. When you finish reading it, what is the casualty relationship of this? So the answer hint is from the method of casualty assessment. Like I told you to read up and then you'll be able to provide the answer. Okay. So that's it about this evidence-based medicine and drug history. Uh, sorry, I think I'm misplacing something. Sorry, that's it about the pharmacovigilance discussion. Don't mind me. So thank you so much for listening. I'm going to see you in the next class. Bye.